Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk about the concept of paraphilias. And have you ever heard the term peeping Tom, or the person in a trench coat, or the streaker, or 50 Shades of Grey? In today's video, we are going to differentiate between the various types of paraphilias, and we're going to differentiate between what is kink versus what is actually a psychological disorder. So if you like what you hear, if you learn something new, give me that big thumbs up, click the like button, subscribe, click the notifications tab, and here we go. So what are paraphilias or a paraphilic disorder? So a paraphilic disorder needs 6 months or longer where an individual experiences recurring intense sexual fantasies or urges that are linked to objects or situations or humiliation and so forth. These urges have to be to the point where a person cannot reach orgasm or a climax without this object or situation being present. And I think that's important because there are a lot of people who feel that many of the paraphilias should not be in the DSM because they're just an expression of fantasy and eroticism, but in the absence of causing any harm to people, what's the problem kind of thing. And other people criticize the concept of paraphilias because it's such a limited case where people need, let's say a person has a foot fetish, right? Fetishism. They need to interact with their partner's foot in order to be aroused or come to climax. There are some people that do that, but many people, it's part of their erotic experience, but it's not necessary. So the one exception to the rule is when we're dealing with non-consenting individuals. Everybody agrees that if a person is engaging in erotic fantasy or engaging in sexual activity related to non-consenting individuals, that is a problem, such as in the case of pedophilia, right? So, these urges, as I said, they have to be persistent. They have to be present in order for a person to get aroused, but it has to cause this individual some level of distress, or it has to violate some basic rules of society. So in the case of a diagnosis, very few people actually get the diagnosis of a paraphilic disorder, although there might be an underreporting of this because people are less comfortable talking about what happens in the bedroom. So let's go into some of the subtypes. There's something called a fetishistic disorder or a fetish, right? And a fetish can be a recurring fantasy or urge relating to anything, any non-living object that turns a person on. And if you can think of it, someone might have a fetish for it, whether it be leather or shoes or costumes and etc. People have a whole host of fetishism. Now, a fetishistic disorder is more common in males relative to females, and it oftentimes occurs in adolescence. So what is the origin of a fetishistic disorder? There have been some theories. For example, in psychodynamic literature, it is an expression of defense mechanisms, but most of the theories have not been fully fleshed out and supported. But we have some treatments from a behavioral point of view. A behaviorist would say fetishes are learned through classical conditioning, so there might be some reinforcement going on. And how do we treat it? So we can treat it through aversion therapy, which creates a uncomfortable feeling linked or uncomfortable consequence linked to whatever the fetish was. Another suggestion is masturbatory satiation, which clients are meant to masturbate to boredom while imagining some fetish object, and it works. Now, in terms of this, we also have an orgasmic reorientation, which is a process by which we teach individuals how to respond more appropriately to sexual stimulation in the absence of whatever their fetish object is. Now, there is, sorry for the typo, transvestic disorder. There is a specific disorder for a transvestic fetishism, which you might hear as transvestism or cross-dressing. So this person has fantasies or urges or engages in behavior of dressing up in clothing of the opposite sex in order to achieve sexual arousal. This occurs typically or develops typically with heterosexual males who begin cross dressing in childhood or adolescence. So it's a mythology that the common case is a person who is homosexual in nature, right? We also want to distinguish the difference between transvestism versus transsexualism, right? Which we refer to as gender dysphoria today. So they're separate. One is getting pleasure or aroused from dressing in the opposite sex clothing, whereas gender dysphoria is a feeling like you don't fit into your own body. The sexual anatomy that you were assigned at birth don't match how you experience your life. So there is a different pattern linked to the two. Exhibitionism or exhibitionistic disorder, you might hear this referred to as flashing. So the picture I conjured up of the person in the trench coat, opening the trench coat, that is a form of exhibitionism. In this particular case, the arousal comes from the shock of exposing oneself. There is not really a need for sexual contact. It's rarely initiated and certainly rarely desired. This oftentimes occurs in adolescence before the age of 18, occurs more in males relative to females. And in terms of treatment, similar to other conditions, we talk about aversion therapy and masturbatory satiation. These factors help with this. Voyeurism or voyeuristic disorder. Voyeurism, you might hear referred to as the peeping Tom, the person who enjoys spying on other people while they're undressing or while they're having intercourse. So that's the person who is watching other people engage in a sex act. A person who has a voyeuristic disorder might engage in some form of masturbation while they're doing this. And there's some thrill in the fact that they might get caught, right? So there's this, thrill of risk involved. In terms of psychodynamic theorists, people suggest that voyeurs are seeking power, and a behaviorist would suggest that it might be traced to some observation of a sexually arousing scene in childhood, that it was pleasurable, but they didn't talk about it. Now, voyeurism is not the same as what you hear in the adult industry, a cam model. So the person who's a cam model, they are engaging in sex acts, but they're knowing that people are watching them. Certainly a person who is a voyeur might benefit or get excited by being able to see what's happening in someone's bedroom, but there's a differentiation here, particularly because uh, there is no spying, if that makes sense, involved. Frotteurism or Frotteuristic disorder. Frotteurism is when a person uh, gets pleasure by rubbing up against a non-consenting individual. So you might experience this on the subway or a crowded bus where you feel like someone is too close. In some cases, this could be a person who's deriving pleasure from the body-to-body contact that they're getting from you being too close to them. And almost always, this is a male who is fantasized of engaging in some kind of relationship with the victim. This usually occurs in teenage years as well, sometimes even earlier, and many times disappears by the age of 25 when mature romantic relationships are developed. Now, pedophilic disorder or pedophilia, this is probably the most popularized discussion or disorder of all of the paraphilias. This certainly is problematic. It is a disorder regardless. We talked about sometimes it's only a disorder when you need it for orgasm. In this case, pedophilia is considered a disorder even if you're not engaging in a sex act with a child, right? So some pedophiles, they get pleasure from watching or seeing child pornography, others engaging some kind of inappropriate physical contact with a child. When we look at the data, we see that victims can be male or female, but 2/3 of the victims are oftentimes male, or pardon me, are oftentimes female. But what that means is 1/3 is male. Now, you ask, well, where does this come from? So, it oftentimes starts to show in adolescence, and many of these individuals were sexually abused as children, or they have some kind of other psychological distortion or psychological disorder. Now, in terms of treatment, as it relates to pedophilia, most pedophiles are forced into treatment due to imprisonment or due to some other issue. So treatments include aversion therapy, which is very important in this case, creating a disconnect between children and arousal, masturbatory satiation, orgasmic reorientation, and anti-androgen drugs. So this is kind of like a libido killer. It's oftentimes a shot that reduces desire, which reduces the risk of children. So CBT, including relapse prevention helps, but these are the kind of treatments you would do. So I know that this is probably the most triggering of the paraphilias, but it is in a larger list. So sexual masochism or masochistic disorder, this person enjoys being humiliated, being beaten, being bound, or made to suffer, right? The masochist is the person who enjoys receiving pain. And we suggest that this also might begin in childhood and develop through some form of classical conditioning. Now, sadism, sexual sadism, is when you have fantasies of causing pain or humiliation or physical suffering to your partner. So this usually the masochist pairs up with the sadist for a mutually pleasurable experience. Now, in terms of the name, it comes after Marquis de Sade. And in terms of sexual sadism, they imagine having entire control over their victim. Now, when people engage in sadism or masochism, we do have to be careful about it going too far. So you might have people use safe words. You might have a contract that is drawn up so that people are clear as to what is acceptable or unacceptable. And then there is another really risky one where you are choking your partner. You run the risk of asphyxiation and death due to lack of oxygen. So the sadist has to be careful, and there has to be some safe word or code word to stop. Now, in terms of the fantasies, similar to, and I'm going to bring a bigger picture together, but similar to many of the other paraphilias, this starts in childhood or adolescence. It becomes a long-standing pattern and usually continues as a function of operant conditioning, modeling, classical conditioning, etc. We also see some hormone abnormalities and brain abnormalities in individuals who are sadists, and the primary treatment is sexual aversion. Now, a word of caution, the definition of paraphilic disorders, like those of other sexual dysfunctions, are strongly influenced by the norms of society. And as I said earlier, some clinicians argue that when people are hurt by them, that's a problem. However, when people are not hurt by them, paraphilic behaviors should not be considered disorders at all. So when we talk about BDSM, right? BDSM would potentially fit into the framework of today's lesson, but many clinicians would say, no, that's just some level of excitement for that person. And there is a movement to remove most of the paraphilias from the DSM. Obviously, pedophilia would stay, Frotteurism would stay, voyeurism would stay. But in terms of, fetishism, masochism, sadism, these kind of conditions might actually go. And we have seen a shift in the mindset of society as a function of 50 Shades of Gray. I think that has moved people into a discussion about non-traditional sexual experiences and involving other fantasies as part of the sexual experience. So if I were to pull back and think about what this lesson is telling us, we're starting to see paraphilias by definition are fantasies or urges that are necessary for arousal and orgasm. Not that you're introducing it into your bedroom, but is not necessary. It has to be a long-standing condition, 6 months or longer, and it has to cause some level of dysfunction otherwise. We also see that in a lot of these conditions, they're starting fairly early. We're talking about childhood and adolescence. So they're early developed because there's a lot of unexpressed sexual fantasy. But as a person matures, many of these normalize. But if needing treatment, the primary treatment is aversion therapy, which disconnects the fantasy with pleasure. So it separates the two. So I know I said a lot in today's video. It was a longer video than some others, but there are a lot of paraphilias. I hope you found the video useful. Give me a big thumbs up. subscribe, click the notifications tab, and give me a comment. What was one thing that stood out from the video, or one thing you learned from the video? I read and respond to all comments. So until next time, take care, everybody.